Thanks for staying with TVC News. Lagos State government has rolled out palliatives for 500,000 vulnerable households to ameliorate the current hardship caused by the removal of petrol subsidy. Senior correspondent Adedoja Salam-Adeniyi was at the flag-off of the Lagos Food Bank program in Ikeja and now reports.
The challenges that many Nigerians are facing with regards to the increase in transportation costs and the prices of essential food items across the country as a direct effect of the policy of the removal of fuel subsidy calls for palliative. Governor Sanwo is kicking off these measures to reduce the hardship, especially on the indigents. Bulk food items such as 50 kg rice, 50 kg gari, and 100 kg beans are for groups involving non-governmental organizations, community development associations, people living with disability, and religious leaders, among others, to distribute to the affected persons.
We have 8 clusters in Lagos State, and it's to be shared among them. It must get to those who really need it, and we will make sure this is done.
In the Spinal Cord Injury Association of Nigeria, we are just about 100 in Lagos State. But the other cluster with larger number of people, like the deaf, the blind, the dwarf, we do the needful by making sure that these things get to those who are most vulnerable among the disability community.
To ensure transparency in the implementation of this intervention, Governor Sanwo said a monitoring committee with members drawn from religious groups, trade unions, people with disability, civil society, and representatives of the Lagos State House of Assembly will be constituted.
I want to assure you that the total number of households that were promised that it will certainly reach them. We'll expect that an household will have children as well. So 500,000 households, and it will be spread around. If you don't have a need for it, please don't collect it. It is for the vulnerable in our society. It is for people that are in need of this thing in our society. We are not distributing it by political group.
A 50% reduction in transportation costs in government-owned buses and free health services for pregnant women in government hospitals, among others, are already in place. Adedoja Salam-Adeniyi, TVC News, Lagos.